Okay. Hello, everyone. Welcome to Digital Health Weekly, where we will speak with Adrin Mammen, Associate Vice President, Patient Access Transformation Officer at Montefiore Health System, one of the leading health systems in the United States, as well as up on the Eastern Seaboard. We are beyond thrilled, Adrian, to have you as our guest today. I'm Dave Smith from Luma Health as your host. As usual, we will cover a wide range of topics regarding COVID and all things healthcare. As usual, we will spend a few minutes learning about Adrian, her journey into healthcare, some of the big opportunities and big rocks that she has obviously had the opportunity to work on in this unique time and place, and also the lights, the light at the end of the tunnel that Adrian is working her community towards. We are beyond excited to have you, Adrian. With that said, let's get into it. Would love for you to share a bit about your background, what led you to pursue a career in healthcare.
Hi, everyone. Pleased to be here this afternoon. Like Dave said, my name is Adrin Mammen. I work over at Montefiore. What led me into healthcare, I think my whole entire life, I knew I wanted to work in healthcare. Is just what flavor of healthcare am I doing today versus what I always thought I was going to be doing. So as a young one, if you will, I always thought I would be a physician or at least a provider of healthcare. And as I kind of matured, I ended up working more on the health administrative side, still in the provider space, but just not being the actual one wearing the stethoscope, if you will.
So let's unpack that for just a second. So was there a moment in time where you had an experience where you said, hey, I'm in love with the idea of helping humans get better care? Was there an experience perhaps that you went through where you said, hey, this should be better, it could be better? Or was it something perhaps more ambitious where you just said, I see an opportunity to make a heck of a difference, and that's my North Star? Maybe tell us a little bit about that.
I mean, as long as I could remember, I knew I wanted to be a physician. So I was one of those children that walked around with playing, doctor games. And I think we had a toy. I don't even remember. It was like used to do surgery and used to go in there and try to pull out like little parts. Mattel made it, I'm sure. Sorry if it was an ad. But that was the kid I was. Had my own white coat and wore a stethoscope and joked around and always thought I would be a physician. I went into college being in one of those 6-year pre-med programs. So I was quite confident I was going to be a physician. But during my undergraduate time, I took a class in health administration, and that totally changed me to the point that I thought that, hey, I don't want to be a physician. I want to actually start to affect healthcare more from a management perspective.
And so using that as a background, I assume it informs many of the decisions that you make as the lens in which you see healthcare. Would love for you to share a bit about Montefiore and the work that you do there today.
Sure. So I've been in Montefiore about 2.5 years, and in my role as Associate Vice President and Patient Access Transformation Officer, I'm largely focused on how patients interact with our organization. And when I say how do they engage with the organization, I'm talking about oversight of many key areas within the organization. So one of the areas that I have responsibilities for is our Patient Access Center, which is our centralized call center, contact center. We take over 3 million calls a year. We have nearly 300 folks, if you will, answering the phone. And so above and beyond the call center type activities, I also have oversight over things like our patient portal, where patients can engage with our MyChart, which is the patient portal we have within the organization, or starting to think about how patients engage with us in various channels. And those channels can be the chat bot on our website, can be SMS when they're engaging with us over their mobile devices. It can be telehealth. And so starting to think, and this is more recent, but starting to think about how patients can engage with us for either a virtual phone visit or a virtual video visit. And so it's really about helping patients have that great experience with Montefiore and being able to engage with us in the platform or channel of their choice. And so really starting to think beyond the traditional phone as the exclusive channel and starting to think about engaging with patients either proactively and not just reactively, but also starting to think about proactive communication in these various channels.
Thank you. So
that's a big summary.
Yeah. So tell us a little bit about what makes Montefiore special in your mind.
Sure. I mean, obviously, any organization, what defines them is who they are, right? And who we are obviously a reflection of two things as I see it. One, the community that we serve and the people that help us serve our community. And so our unique population, so, being where we are, we're in New York City, situated in the Bronx, and also up into the neighboring counties like Westchester County and Rockland. And so our community defines us, and we have to be reflective of that population. And so being in Manhattan, urban setting, we have various socioeconomic factors that define our population. So for example, when we're talking about engaging with our patients, let's just take our call center, for example, we have folks that speak two languages. So we have associates on our team that speak English, and we have quite a number that speak Spanish. But above and beyond that, we also have language translation services so that we can try to accommodate all populations and all language speaking people. We also have to start thinking about, are people having mobile devices, for example? And so if they don't have mobile devices, can they also interact with us utilizing technology? Starting to think about things like digital divide. So our population is very, very unique. Everybody may not be computer literate. We have people of different ages. So, certain populations may need one strategy to engage with them versus other populations, subpopulations, if you will, need other strategies for us to engage with them. So really, again, like I said earlier, when we start thinking about the channels, we want to meet the patients where they are in their preferred channel. And so we're really at Montefiore starting to think about what other channels that we haven't had traditionally, even what other channels can we bring in or even evaluate so we can meet the patients where they are.
So let's circle back on that innovation in a minute, because I think that you are and have a reputation as being an exceptional innovative thinker. So we'll go through that door in just a second, and I know the audience will benefit from that. You also have a deep expertise with process, being a master black belt and being Six Sigma trained. How do you avoid over processing things, knowing what you just said, which is we're about the people we serve and we're about the people that are serving the people we serve, which is a human-centric focus. Through our dialogue with other health leaders, there's always this balance between the process and the impact of process and the benefit of process, but also sometimes process can create distance between the purpose of an organization. And so being now at Montefiore, into your third year, how do you view that today? And how do you use that in your decision making?
It's actually a really great question, because it's very easy, especially given my background, to over solution something, if you will. And so, you know, we talk about highly reliable organizations, high fidelity organizations, talking about creating processes that are defect free. And so for everyone else, you know, my background has been process improvement, 15 years in trying to create processes or refine processes so that we don't have error. And so when you evolve into now creating your own processes as opposed to reacting to inefficient processes, you have to think about it differently. And I think my many years in fixing things has prepared me really well to start to define processes that are highly reliable. And so one thing, and my team members will tell you, I'm frequently found saying, less is more. So, if you have more steps, the opportunity for errors, opportunity for defects gets increased. So let's keep things simple. Let's minimize variation. That goes to my black belt days. Let's minimize variation. And to the extent that we can do it right the first time, or create processes and think through the workflow so that if an error is going to happen, that we can kind of robustly industrialize the process to minimize or mitigate that potential risk.
Thank you. So we're going to definitely circle back on less is more, because a general theme for leaders like yourself has been the more of health IT over the past X number of years. And to meet the growth objectives of consumerization of healthcare. And so we'll circle back on that, because obviously all of us at our core, we're all patients, but we're actually all humans. And being humans, we're all consumers, which means we've been disrupted by COVID in different ways, which has created access to consumables that we rely upon. And that chasm has been crossed by technology. So we'll circle back on that, but I definitely think there's some brilliance there as it relates to what you were saying, which is less is more. Try to identify the deviations as they're happening, which then turn into potential defects. And with as many folks as there are that are reliant upon your wisdom and strategy to execute the mission of Montefiore, I just think there's a huge amount of wisdom there in what you were saying. Let's ask the question that's the elephant in the room, which is, take us back to February, March of last year. So February, March of last year, if my math is right, you're ending your first 15 months in the role. You got big ambitions, and then next thing you know, everything seems to be, whoa, right? Something is about to happen here. Walk us through, and the audience through, being as number one, as intellectually capable, number two, as process driven. How did you view what was happening, and what were some of the things you put on your whiteboard that were big ideas that you thought would happen and you needed to do in March of last year? Let's start there. So we'll take February, March, April, that general time frame when there was a tremendous amount of chaos. But what was the clarity you saw? How were you feeling? Give us a sense on what was happening.
Sure. So we have to kind of step back in time. So about a year ago, it's mid-March, maybe about the 8th or 9th of the month, one of our neighboring towns, New Rochelle, had the first incident, if you will, of COVID-19. And, I still remember the rumors like, The National Guard has arrived. They shut down the town. We were just like, what are you talking about? You know, it was just a little bit of confusion in the beginning, to try to understand what's going on. But then that confusion quickly turned to accelerated, we have to act, and we have to act now. And so what ended up happening was, we quickly realized that this was going to be an exponential impact, not just to our community, but eventually our nation. But New York, you know, we got hit with COVID-19 first. And so we didn't have the luxury of learning from others and embracing the changes that they did. So we had to basically learn as we went. You know, one of my other mantras, and I say to my team all the time, is my biggest lesson in 2020 is let perfection not be the enemy of good. I learned throughout that year that you do something, you can modify, you can learn from it, reapply, readjust. And so come, you know, late March, we knew very quickly that our ICU beds could potentially be running out. We knew very quickly that we might have to cancel elective surgeries. And I sit within the ambulatory world more than the inpatient world. So with my ambulatory hat on, I knew also that we didn't have a robust telehealth strategy. And very soon I was put in charge with standing up a telehealth platform. And we stood something up within 10 days from the day I was asked. You know, we had stood something up by March 23rd to enable us to do phone and video visits. And then shortly within, by April 1st, we had our own platform ready to go. And so had we not done that, we would not have been able to pivot as quickly as we did. A lot of the actions, I'll say, in those last 2 weeks of March were largely around speed to execution. And you know what, when, you know, and maybe it goes back to what I said, you know, I wanted to be a physician, and that altruistic behaviors that bring one to healthcare. It was sort of that situation that drove me to saying, you know, what is sleep? What is working 7 days? What is working 18 hours? It was just sort of the quicker we worked, the quicker we did more. It meant that this pandemic, which we didn't really appreciate as a huge pandemic at that point, but we knew was bad. We knew that the quicker we reacted, we might be able to save lives. So it was worth it. So there was a lot of quick like movement, a lot of agility, and starting to just let's stand something up versus, you know, in our regular norm pre-pandemic, it was, oh, let's model this out and create a Visio and put a project plan together and think through who's going to pay for it, and, you know, figure out all of the workflows. And that same accelerated innovation, let's say telehealth, that we stood up in 10 days, 2 weeks time, that same innovation may have taken us 10 months to implement in a normal time frame, right? So everything, our situation just forced us to accelerate everything and to do things maybe not as pristine or as perfectly as we would normally do. And truthfully, it's never perfect, even in our normal world, right? We learn from it, we adapt, we optimize, we make better. But we were able to accept less perfection because of the immediacy of the situation. And so, you know, we found ourselves standing up telehealth visits. And it's a good thing we did what we did when we did, because very quickly our offices started to shut down. And, you know, by April, May, you know, we had a good 60-70% of our visits shift from in-office setting to telehealth. And so, you know, we were able to embrace the change quickly because we had to. We were able to be more leaning towards, you know, digital innovation and embrace some things that may have taken much longer, and that learning curve got drastically accelerated. And so, you know, some good things did come out of COVID. It's an unfortunate situation, even 1 year later, still horrible. But little things like digital acceptance or digital innovation has been really, really great. And, you know, there's going to be more to come. You know, we've grown more in 1 year in the digital health space than we did in the decade before. So it'll be interesting to see how the next few years pan out.
So let's grab a hold of that topic and spend a minute there. So how do you how do you process and think through this transformation that happened, and what part of the patient relationship, the patient engagement process, what do you think will go back post vaccine to how it used to be, like walk into an office, fill out forms, versus fill a screener out on your phone, um, get notified in a parking lot that your time is up, come walk in, versus just walking in, scheduling, being able to communicate back and forth. Obviously, COVID forced the hand of this digital transformation within the patient to provider relationship, or the health system to the patient. How do you what part of the genie goes back in the bottle and what stays? How do you think about that?
And it's a really, really great question. Even pre-pandemic, I always knew that this was going to happen. I just didn't know how quickly or when even. And some of the conversations we've had in-house was, let's think about the banking industry, or let's think about the travel industry. And we were planning for, some of this digital work that we've done and that we're planning to do. We planned for it pre-pandemic. We just didn't plan for it at this pace. One of my colleagues, he says that we're in the golden era of, healthcare in terms of digital transformation. And I completely agree with that. Some of it will get unwound, right? And some of it, but the fact is, we have to embrace the fact that people have already started on this journey. And so I still go back to my statement earlier, let's continue to meet patients where they are in the channel of their choice, right? And so again, have oversight of the call center, the patient access center in our organization. Will we still need a call center? Yes, we still will need it. We will still have calls that come in, just like you still have phone calls that go into your airline company or your hotel to make a call. But we can still shift some of the work to self-service activities if the patient wants to do things on their own. We can still engage with patients utilizing other technologies that even our organization hasn't done yet, like chat, let's say, for example. So there's a place for each of these channels, and there's a place for all of these engagement opportunities. Um, but everything need not be 100%. It's additive. And so let's meet the patients in their preferred channel. And I've said that a few times now, but let's continue to meet them where they want. And if they want it, it'll be embraced. And then you build out whatever they continue to embrace. And we'll start to see shifts, right, as our population changes. So for example, as the baby boomers become the seniors, or the millennials eventually become the 30-year-olds and the 40-year-olds, even what each generation embraces in terms of whether it's technology or how they want care delivery, it will be evolving, right? And so how we as leaders, or how we as healthcare providers choose to embrace that evolving population, what might make sense this decade may not make sense next decade and the following. We'll have to continue to evolve and kind of just feel out what our population desires and continue to embrace what they desire.
Totally. We love that way of thinking. It definitely is prescriptive in what we are seeing great leaders across the industry doing. I mean, I think you hit the nail on the head, where it felt like previous to the pandemic, there was an extra emphasis on the 5% that might not work, as opposed to the 95% that would work. And given what you were sharing just a minute ago about, what's the quote you perfection can't be the enemy of good. And if good is 95%, perfection's the next 5%.
Right.
That 95% time to impact that you were sharing is foundational. I would love for you to use that as a basis to talk us through how you prepared for vaccine delivery, using the lessons you learned from May through the summer, knowing that that the vaccine was imminent at some point. It clearly looked imminent, got closer, closer, closer. How did you process how it would work? What were some of the things that you wanted to accomplish? Walk us through that, if you don't mind.
Sure. So obviously, we have to keep in perspective that Montefiore was again in New York City, where we had one of the worst COVID-19 positivity rate. So keeping that in the back of your mind, what we started to see even in November, because the press and media, they started talking about vaccines and, patients may not know what the vaccine is by name. They might know it now, but back in November, they didn't necessarily know it by name. They didn't know if it was approved by the FDA or not, but we started to get phone calls into the patient access center. And it was like calls like, I want a vaccine. Well, there are no vaccines that are approved. How can we give you a
Right.
vaccine that we don't have? So we were quickly attuned, we talk about voice of the customer and listening to our patients and always be listening. But we knew very quickly that if people were asking us early November for vaccines and the vaccine hadn't even been approved, that maybe our population would want vaccines very quickly. We also recognize that even if 10% of our population, 10% of our community wanted to accept the vaccine, that wasn't going to be an easy undertaking to now get people in through the system to schedule. So you got to remember the patient access center, we're the team that schedules all of these appointments. I'm just, doing math in my head and I'm like, there's no way we'll be able to do this with all of the other activities that we're already doing, right? And so, we started to think about, okay, the vaccines will get approved in December 18th. It'll take, 2 weeks for it to kind of get out. So we kind of had a sense that maybe right before the end of the year, we would be thrown into the madness of vaccine deployment, vaccine delivery. So, it's early November. We're starting to think about this. We're starting to think about, okay, there's two ends of it. I'm thinking to myself, we have to get ahead of vaccine, the ability to schedule vaccines. The state, believe it or not, had started to kind of define, along with the CDC, the various cohort groups, and we had a sense of where we were going. Come around Thanksgiving, we kind of went into overdrive at the Patient Access Center, really, really starting to think about mapping out workflows, Visios, starting to think about how all of this fits in together, knowing that this is inevitably going to come to us, right? We may not need to know about how to give the shots, which is the second half, the actual delivery of the vaccine, but I knew everything from a patient wanting a vaccine to getting scheduled will more than likely fall in my lap. And so how do I manage that? And it's basically a scarce resource and everybody wants that same scarce resource. And so we had to still abide by the guidance that we were going to get from the city or the state. Now, all of this we didn't know the answers to at that point, but we knew that this is where we were going. And so, we started thinking about how we're going to do it. We actually already set up phone numbers so that people can call in. We started creating that infrastructure. We started engaging in early December. We started engaging with IT to say, hey, we're going to need vaccine departments and what will that look like, and starting to build out our EHR, Epic in this case, to start thinking about visit types. So what does all of this look like? So we had some of those conversations in December very early. I still remember a specific Visio that I had created where I basically said, we have to start thinking about having various cohort groups and start thinking about these cohorts or populations as your door is open to schedule and your door is not open to schedule. And so how do we allow some people to schedule and not allow other people to schedule? How do we ensure that all populations can pick up the phone and call if they wanted to, but yet if they wanted to help themselves, because we knew we were going to get overwhelmed, if they were able to self-schedule, how do we also encourage self-scheduling? So it was a little bit of a dilemma, and we started, a few of us started putting pen to paper and started thinking about what that potentially could look like and how we could potentially even leverage technology to help us overcome this challenge that was in front of us.
Thank you. So let's spend a minute on the connection of the people, the process, and the technology. So clearly, building out the call flows, looking at the empathy of the patient population that you support and serve, having that as a guiding post, knowing that there's this, at the time, finite resource that is going to be highly in demand by X number of folks, the community you serve. Walk us through what you were looking for from a technology partner. What was it that was more important, less important? What was good? What was going to be perfect? Going back to your, perfection in the face of good. Maybe help us rationalize how you did that pros and cons chart as you were forming your execution plan.
So a lot of it had to do with, we knew that from a technology perspective, we wanted to enable self-scheduling. We had multiple tools in-house that we could leverage. And also we could go to market and potentially start evaluating different things. But ultimately, it was about speed, no differently than the year before. In March, we needed to be able to execute. And so we started looking at technologies we had in-house in terms of enabling our patients to schedule. And so whether it's leveraging our patient portal or leveraging existing technologies, which enabled FHIR APIs to kind of go and connect with existing slots in Epic. And so we kind of went with both of those strategies, leveraging the APIs or the technology to schedule directly into Epic, and however those are. So, we had the patient portal option, and then we had the option to schedule within the platform, and those are what we went with.
So, thank you. So let's tilt over to early signs of success.
Mm-hmm.
What were they? What made you feel, I don't want to use the word accomplished, but if you look at, you had this task, you connected the back of house and front of house so that you could do self-scheduling. You had your call center, then you have Epic. So you have, you have this system now connected. What were some of the early signs of success? How did you hear them? What did it sound like? And what did it feel like?
Yeah, I mean, I'll say one of the earliest signs of success was when we, I'm a numbers girl through and through. So when I was able to see that the technology was able to be as productive, or even at pockets of the day, be more productive than the call center, that was a pivotal moment for me. And maybe not for the whole day, but maybe for 1 hour, the technology was really, really helpful. That to me was a remarkable day. And I still remember when we sent SMS to a good number of our employees and told them that they can self-schedule by clicking a link. And I still remember sitting there and just seeing scheduled. They're in the form, they're going to schedule, they scheduled, and seeing that conversion, if you will, of they went from an unscheduled state to a scheduled state. That's rewarding, because then you know that the technology you put in is making an impact. And knowing, way back in our conversation, we talked about the community we serve is the people, and then the people that do the work, our associates. And so now here we have our associates now being able to schedule their vaccine, and we've protected them. it's kind of rewarding. It's very refreshing. And we knew that right away. As soon as we implemented, we're seeing people scheduling and making it easy for them to schedule. It was a Sunday afternoon, Sunday evening, 6 o'clock. And in that first hour, hundreds of our own team members, our own associates, being able to schedule their vaccine appointment for maybe the next day or maybe in the next 2 days. It's rewarding. And it's also reassuring now to hear that they're healthy or can be healthy and protected from the virus.
So I think I know why, but I would love for you to just take a second and share for the audience this magic that is now possible between the call center and this asynchronous ability for your patients to self guide either through my chart or through other technologies that they have. How does that make you feel about your ability to deliver a more comprehensive experience into the future for your community?
It's very rewarding, right? So, it's 2 a.m. in the morning, and I know, well, let's say pre-COVID, I knew I wanted to get away for the weekend. I could book my hotel reservation and my flight. And literally, I could be on a flight that evening, right? But why can't we do the same thing for healthcare? Why can't I decide at 2 a.m. in the morning that I want to see a doctor right now, but maybe that's too much to ask immediately, but why can't I say, if possible, I'd like to have an appointment schedule and schedule it right then because that's what time is convenient for me to schedule. And so again, it'll be interesting to see how all of this fits together. There's a lot of changes in the regulatory setting that is encouraging more of this transferability of data and your patients are no longer just your patients anymore. Just because of the data that can be shared across organizations and the patient's own ownership of their own data. And so that's going to change us. And, there was a time when you're a Montefiore patient, and you're loyal to that organization. And that might change, not just for us, but for any organization. There's that sense of, I am only that doctor's or only that office or only that health systems. Those walls are going to go change. And as those change, we have to do more to retain our own patients and to create a sense of loyalty. And these patient engagement platforms are one of many vehicles, but one vehicle to help create that sense of loyalty and brand recognition.
This is an awesome opportunity to jump back to what I told you I wanted to circle back with, which is innovation.
Mm-hmm.
So you're a exceptionally innovative individual. I know that because obviously we're so fortunate to partner with you particularly, as well as Montefiore, and I see the thoughtfulness and the measured approach, but I also see your vision and view of what can be possible going forward. Would love for you to share with the audience a little bit about some of the innovation that you think is possible and capable, assuming that technology is going to solve data security, privacy, because it typically always has. There will always be
Mm-hmm.
issues with that. I mean, we once lived in a day and age when you had to put your credit card onto a machine and swipe it left and right, and we trusted that the pink slip that they kept was secure and safe. And now we live in a world where everything is done digitally, right? So we know that technology is going to meet that opportunity. So assuming that's not there, assuming that it's safe and secure, walk the audience through what you think is next. How far can patient access and self-choice and the democracy of giving me the ability to do everything I could do with your call center online. That way, when I call your call center, it's more experiential than it is function and process. Walk the audience through a little bit about the world you see. I think they would benefit.
Yeah. Firstly, the point about data privacy and confidentiality and HIPAA and what have you, it's an evolving world in the sense of, the regulations are in place, but the technology is fast advancing. We have things like blockchain that have really, really helped improve security and privacy, or even the transferring of data from one platform to another. And even the fact that we have FHIR APIs to talk from one platform to another, or to have backend access. And even, there's different versions or different flavors of it. So it's definitely helping us move to this brave new world of whatever this technology is going to look like. If I had a magic crystal ball, where I'm looking at, a decade out, I think people are going to embrace digital health, going to embrace virtual care in a much, much different way. We're going to start to see, again, I'm completely doing crystal ball. I mean, I don't know, but this is what I suspect. I suspect that people are going to embrace telehealth in a way that they've never done it. The fact that payers are going to now move to virtual care first. So, back in the 90s, the HMOs used to say you had to go to your primary care physician first to go to your specialist. Well, now they're starting to say you need to have a virtual visit first before you go to an in-office visit. I think patients will embrace it where they can, if they don't have a digital divide and they're confident in terms of using devices, they'll embrace it a lot more than, say, others that don't. And so for those patients, they'll be able to, they'll like the fact that they don't have to take off from a whole day of work. From a patient satisfaction perspective, the doctors are actually more on schedule, if you will, because it's a scheduled time with almost a scheduled end time, and you can't really run too late. So patients will embrace that. So virtual health will take off. In terms of inpatient world, I think hospitals without walls will kind of become a new flavor, and the technology that's evolving around remote patient monitoring and use of sensors will enable us to have shorter length of stays in hospitals and start discharging patients earlier with more monitoring technologies. I think early in my career, I heard of this term hospitalists, and maybe I'm making it up, but I think we'll start to see telemedicinists. Versus certain providers just choose to have virtual care visits. And those virtual care visits could be a video visit, can be remote patient monitoring, can be caring for your inpatient patient who's now at home. And so I think virtual care is going to go leaps and bounds. In terms of patient access, I think no differently than the banking industry or the travel industry. I think we're going to have to be able to support patients 24/7. And some of these technologies will be the enabler for allowing self-service. I also think that the ownership of data will start to become more transparent. We've started to think about, at least with the new rules, that patients can have access to their own data. If they ask an organization, they can now get access to their own data. But soon it'll be the provider-led organizations that are starting to think about what can they do with that data, and even across organizations. Again, this is my opinion. Mm-hmm. It's going to be a new way of thinking about healthcare, and those organizations that are ahead of it will be able to maintain that loyalty, right? Why do our supermarkets have loyalty cards? Oh, because there's a value to that patient, or that value to that customer, excuse me. And so, there's a value to our patients, and, we want to do right by our patients and not just give them the best care that they can get, but be there for them when they want to reach out to us, whether it's 2 a.m. in the morning or 2 p.m. in the afternoon. And so it's going to be interesting. I mean, who really knows? I mean, I'm just reading some tea leaves, and some of it is just completely crystal ballish. One never really knows, but we have to be willing to embrace. I think COVID has put us at a critical point where the industry has accelerated digital innovation, and There's more dollars being funded to digital innovation. So, you have venture capitalists and others that are willing to fund these tech firms, and these tech firms, it's highly competitive. And so they're getting a lot of dollars being pushed in. And so if they have the funding, they will continue to innovate. And I think the innovation will drive and push healthcare forward. That's my 2 cents.
Thank you. We're so grateful for your time today and your expertise. My parting shot is it's individuals like you, Adrian, that is creating the future. And it's very evident through these conversations that we're fortunate to have that the future is literally being created in real time, in a time where it's never been needed more. And so on behalf of our audience and our community, we're so grateful that you took the time with us today. As a standard practice, we will open up the opportunity for those that are wanting to reach out to you, et cetera, for comments or questions, and we would hope that you would be open to that. My final question for you, to kind of ride us off into the sunset, is what you've shared. You've shared the innovation potential, but what gives you hope in healthcare? And what are the images from the past year that, if you kind of think about, a photo reel, and you say, I've seen this, the beautiful yet difficult role that humanity plays in the industry we both have chosen to make a profession, and those that our audience are listening to. But what gives you hope? What gives you hope from what you've seen from your community that you serve and the incredible providers and people that are delivering that?
I think what gives me the greatest hope is the fact that our industry is not stagnant. And so, I come from a world of academic medicine where we always talked about research and doing this study or that study as it relates to drugs or this clinical intervention. But the fact that we're also starting to think about innovation and engaging with patients and starting to build up the other half, if you will, the front office, back office, not the clinical area, and starting to think about how patients engage with us, and the fact that patients are willing to embrace this change. So one, that the change, I think that the hope really is that the patients are ready and the organizations are ready. And so now if both parties are ready, why can't we create a better, healthier, more engaged patient? And if they're engaged, there's been plenty of research on this. If the patient is engaged, the patient is happier. If the patient is happier, their outcomes are better, right? And so at the end of the day, what we're all striving for is healthier communities or healthier patient population. And so if engagement is a key strategy to help with outcomes, why don't we do it? And it sounds like everybody's ripe for that change right now. And so that gives me hope.
Thank you so much for taking up, ending this conversation with that. I think it's meaningful, it's appropriate, and I think it's proven. And the work you certainly have done, not only with the COVID work, but what you have been able to instrument and architect to levels and degrees of success that are giving your community, those that are able to self-serve, those that are able to get answers. That is hope right there. And we're so grateful that you and Montefiore are advancing, that bigger mission. So thank you for taking the time. We are so grateful for it, and keep doing what you're doing, because it makes a difference. Thank you very much, Adrian.
Thank you. Thank you for having me. Take care, everyone.
You bet.
Okay.
Okay.